Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Jay Anders. He's a physician executive. Today's Kevin MD article is Healthcare's Data Problem, the Real Obstacle to AI Success. Jay, welcome back to the show.
Thanks for having me, Kevin.
All right, so tell me, before getting to the article itself, what led you to write it in the first place?
Well, it's interesting to see the advent and the explosion of AI, and it's producing a whole bunch of data that may or may not be correct. And it's interesting as I started looking into this more and more and more, both in my personal family adventure with healthcare, but also with others, how much bad data is really out there. And what I mean by that is it's just flat incorrect, and it's getting propagated almost because of AI, but not really. We've had this problem for years.
All right, so tell us about the article itself. Give us, of course, some examples of what we're talking about as it relates to healthcare.
Okay. One of the more interesting things, with healthcare data exchange right now and all of the HIEs and QHINs, there's data being propagated across multiple systems. I'll give you a couple of examples. There's a big difference between two very common things: never smoked or not smoking. Think about that for a minute. So never smoke is I've never smoked, never had a cigarette in my mouth, never had a cigar, pipe, nothing, no smoking. Not smoking, however, is I stopped this morning. I'm not smoking now. So does that change the risk profile of a patient? It certainly does, but it's being propagated throughout the system as the wrong data. So people are starting to transmit this. It's being accepted into the receiving system, sent by the sending systems without any type of cleanup and or coding and a whole host of other probable manipulations that needs to happen to make sure it's correct. The other issue is that there are incorrect diagnoses that have been propagated from one system to another. And I'll give you two examples of that. The CEO of our company, whose father died of liver cancer, had put in his chart that he has liver cancer. So he went to one of his physicians and but you're doing really well. Look at you. The chemo must have worked. It's great. I don't have liver cancer. His father had liver cancer. So he's had a heck of a time trying to get that expunged out of his medical record. Recently, my own family went to their physicians and I got an after summary readout of an ambiently generated AI note. And it was absolutely littered with errors, meaning just misconstrued. You having a conversation with your clinician or your provider, and it's just not coming across in the ambient. And what's interesting about that is we've had that problem forever. When we would dictate our notes, we need to read our dictations. We need to make sure what we're putting down and putting our name to is actually correct. One of my other colleagues in their AI generated ambient listening note changed from a he to a she 3 times in the same note. So when that all gets propagated and all gets transmitted, there's an issue there. And I think sooner or later, it's going to catch up with folks. And I'm mostly concerned about patient care, obviously. I'm a physician. I want to make sure that the patient's information that I get is correct and I can act upon it or trust it. The other issue is more patient-specific, meaning that if something is in your medical record that's incorrect and you go and apply for health insurance or you go and apply for life insurance, how's that going to play going forward? So we've got a data problem, and it's multifactorial as to why.
So let's talk about some of those reasons, because as you said, even going all the way back to dictation, right? You could have dictation errors, which also introduces bad data into the health record. Are you saying that with the propagation of these ambient AI documentation systems, that problems is just getting exponentially worse because the ambient AI is just misconstruing or not picking up or entering inaccurate data?
I think it's accelerating it more than anything else. There needs to be a human in the loop. And when AI is applied to healthcare, that's been one of my mantras forever. There needs to be a human in the loop. And there needed to be a human in the dictation loop as well. It seems to be that the errors are easily created the physicians and clinicians aren't paying attention because I think they've been lulled into this is going to fix my documentation problem. I don't have to worry about that anymore. Well, you kind of still do because it's not perfect. So you got to make sure that what you're putting out there is accurate. But I think and I'm all for ambient listening. I'm all for trying to create systems that will accelerate physicians and keep them from being burned out and help them do what they have to do. What I'm not really seeing is, yeah, there's some help there, but it's actually creating a different problem than we had before. So I think it's accelerating it as opposed to trying to correct it.
And is it just a matter of clinicians just not reading the note that's generated by the ambient AI and just accepting it as fact?
I believe that's a big part of it. And think about how much volume is being created in one of these ambient listening systems by AI. So as you go in, as you probably do with your providers and I do with mine, you have a conversation. We're physicians, it's physician to physician. It's a little different conversation. So all of that conversation is getting picked up and analyzed. So it actually creates more of a volume of text that has to be parsed through and made sure it's correct than in the past when we've had straight dictation, when it's my mind creating that. Now I may make mistakes, but I'm still responsible for it. But it's a different method of creating that text note. And that's what these all are. They're just blobs of text that could be incorrect.
So ever since large language models became popular 3 to 4 years ago, there's been exponential improvements in these algorithms. Has there been that same evolution when it comes to ambient AI? And if so, how much more further do we have to go to deem these systems as reliable as we'd like?
That's a really, really great question. I think in the last 5 years, they have improved up to, I will say, the 90 to 95% accurate level. It's the 5% that worries me in healthcare. It always has been. The devil is in the details. If it's incorrect, it's incorrect. So instead of being a replacement for any type of review, it just adds more of a burden of review. So has it gotten better? Absolutely. The thing that I see most now is just the pressure now is like it has switched from actually having to dictate or write a note or type a note to I've got to read it and I have to read it carefully. And it only takes 1 or 2 or 3 mistakes and you've got a real problem on your hands as a clinician, as a patient. So there's no cross checks in this. The clinician now is the cross check. Are there systems out there that can review these notes and apply some medical knowledge to them? Sure, there are, but they're not being widely used yet. So I think it's gotten better. It's not perfect. I don't believe it will ever be perfect. I think it's up to the clinician practicing medicine to figure out exactly what they want to say about a patient sitting in front of them, make sure it's accurate and correct.
Now, is it just these ambient AI technologies that are leading to inaccurate data in our health records? What other technologies that are related to AI is also introducing inaccuracies into the record?
That's another great question. When it comes to AI analysis of a patient visit, one of the things that AI is not very good at right now, and it's getting better, but not very good at it right now, is coding. And what I mean by that is a level of visits, diagnosis coding. And that is really relegated to somebody has to review to make sure that diagnosis is correct. So you'll get this note, and then you'll have a diagnosis that note has been labeled as, and you've got to cross-check it. So, and you've got to cross-check the code as well, because one of the things that AI does, which is still fascinating, is that it will make up what it doesn't know. So, and I'll challenge anybody out there, take any AI system you like and try to get it to code correctly, because every now and again, it's just going to make up a code. And that's going to get propagated. It's errored. It's going to go to an insurance company who's going to say, that doesn't work. It's going to come back to you again. So there are things that are being improved, and coding is one of them in a way, but it's still, again, you've got to have a human in that loop to make sure that that's correct.
So, short of having physicians better check their notes before permanently putting in a medical record, what other paths forward or solutions do you propose?
Well, a couple of things that there are, the LLMs are not being medically trained in a very concise manner, meaning that they try to match millions of words, and it's very difficult to get that correct 100% of the time. So there are other ways to filter that kind of output, to cross-check it, to help the clinician get flagged that, hey, look at this again. It's not quite right. Do you want to revise it? So I think there's going to have to be some type of technology stuck in between what AI is producing, how it's trained, and what's presented to the clinician. And if AI doesn't know something, then it needs to be able to tell the clinician that it doesn't know. And I'm not, you can't accept this as truth. And that's going to be another major step, I think, in AI and healthcare as a whole, and especially with this bad data problem that we have.
So you're proposing having that in between model. So you have the ambient AI parsing the discussion, but then you have also that AI cross-checking what's happening in the discussion versus what's really in the medical chart. And if there are any discrepancies, bring that to the attention of the physician before entering into the medical record. Am I hearing that right?
You're hearing it exactly correct.
Do those
Yes,
systems exist?
they do. They do. There are pure AI systems, and there are other curated systems that are out there that will do that kind of thing. So there's a way to alert physicians. One, there's a couple of EMR companies I know right now that have implemented something just like that. So when AI doesn't know and it's presented, it will actually have a big italicized line in the output that says, I can't find anything that this matches, or I can't find this anywhere else. Are you sure you want to say this?
Now, what will be an example of something that they would typically flag?
More often than not, it is a missed physical finding, or a misconstrued physical finding, or a misconstrued history item, and a misconstrued diagnosis. Those are the three areas I see it most. So if it can't really match that truly is a medical history or even a medical term, then it would flag the clinician to say, hey, we can't, this is not a medical term that I'm aware of, nor is it in the patient's chart right now. You still want to do it?
And are you seeing that as probably the next step in terms of the evolution of these documentation systems, having that go between AI to cross-check it? Is that universally accepted among a lot of these ambient AI companies?
Nothing in AI is universally accepted. That's one of the issues. I think it would go to a long way for transparency
Mm-hmm.
and documentation of trust. And this thing is going to tell you something. If it doesn't know, it's going to tell you it doesn't know, as opposed to here it is, believe it. So I think, yes, it would go a long way to build that transparency, that trust with clinicians. On the flip side of that, AI companies, and this is just another one of my opinions, they're focusing on, and I've read this now several places, replacing, say, a mid-level provider, a nurse practitioner, or a physician assistant with AI. That to me is a bad idea right now. It's not there yet. And people are just racing towards replacement theory for clinicians and AI. It would be better to augment what a clinician's knowledge and expertise is than it would be to try to replace it. Those systems are getting much better at being more accurate about things, and there's multiple demonstration projects around that. But ultimately, the person that's responsible for the patient care is the clinician. So, nobody's going to sue OpenAI when they come up with a misdiagnosis. At least they haven't yet. That's obviously positive or possible. But I think that's part of the whole evolution of this. Let's concentrate on what it really can do and do well, put humans in the loop so that it's cross-checked, and then have another, like, are you sure?
Mm-hmm.
Before you actually say, I'm finished with this.
So obviously you've been studying this area, always interested in asking people like yourself who are familiar with the trends, what do you foresee in the next year or so when it comes to that intersection between AI and what I do as a physician? What do I have to look forward to given how quickly things are evolving in the space?
My hope is that you will start to build more trust into the systems that are being implemented. And we get rid of the examples I just talked about, those things that pop up and they're not reviewed or they happen for whatever reason. I think we can look forward to the fact that it's going to become more and more accurate, but we can also look forward to the fact that it will not replace a trained clinician. It can augment them. It can really help them do what they have to do. But let's get off the kick of, oh, AI is going to solve medicine by it's just going to do it. And I had a very interesting conversation with a surgeon, actually, who is, I said, what happens when AI says you have appendicitis? Is AI going to take out your appendix? Well, this is the response I got. Well, it will recommend antibiotics. I said, okay, if your appendix is inflamed, do you want it taken out or not? You're a surgeon. Do you want it out or not? Oh, absolutely. Well, there you go. It's not a replacement for surgery. It's not a replacement for any of the procedurists. It can augment them, but it can't replace them. And I think that concept needs to bleed on down to all internal medicine, which is my specialty, family practice, general OBGYN, all of that. Let's get off of this replacement thing and let's talk about exactly what we can do to train these systems better, make sure their output is checked and correct, and make it easy to put the human in the loop.
We're talking to Jay Anders. He's a physician executive. Today's Kevin MD article is Healthcare's Data Problem, the Real Obstacle to AI Success. Jay, let's end with some take-home messages that you want to leave with the Kevin MD audience.
To all my colleagues that are out there using ambient AI, I salute you for taking it on. Please read your notes. Please read what it's putting out because it's very, very important. And if I could, that's my major take home for what I'm talking about today. The other is you have to realize, and you know this already, everybody does, that what you write and what you record is something that is permanent and very hard to get rid of. So you've got to make sure that it's the thing you want to put in that medical record before it goes in, because getting it out is very, very hard.
Jay, as always, thank you so much for sharing your perspective and insight. And thanks again for coming back on the show.
Thanks for having me, Kevin.